Hi there, welcome to this short and to the point video on the use of fentanyl. This video will cover all the essentials: how and when to use fentanyl, what is the correct dose, what are possible side effects or concerns, and can you use it in pregnancy or when giving breast milk. I also made a more in-depth video. It covers everything you need to know, and you can find that one in the description. It's suitable for medical professionals or medical students. So, if you like this video, feel free to subscribe and let's get into it. First, a little disclaimer: this video is meant purely informational. This is not medical advice, and if you're looking for medical advice, always contact your own doctor. So, the generic name of this medication is fentanyl, but is known under several brand names, among which Abstral, Actiq, Duragesic, Fentora, Effentora, Instanyl, Recivit, and Pecfent. It's exactly the same substance, the same medication, but a different brands that makes it. And it's available in tablets, nose spray, and band-aids. And there are some different tablets. You have a sublingual one, which means you can put it under your tongue. You have a lozenge, which takes a little bit longer for it to work. And a normal one, which is in medical terms called buccal one. Then, when do you use fentanyl? And fentanyl is used for breakthrough pains. This means you need to take other medication, maintenance treatment to create a certain level of painkiller, and then when this is insufficient on certain times, when you have pain peaks, then you take the fentanyl for the breakthrough pain. So it's commonly used in people with chronic pain that use other painkillers, experience more pain, for example, when they are changing themselves, and then they take the fentanyl. So how do you use it? You take the tablet or the nose spray, and within an hour it will work if you take it the tablet. If you use the nose spray, it will take 5 minutes, and it will work upwards to 7 to 24 hours. And it's important to note that you do not take fentanyl on fixed times, but you only take it when you are having complaints, breakthrough pain, and then you take the fentanyl. How long can you use it? As long as your doctor prescribes it, as long as you have severe pain, and when you use it for several weeks, then together with your doctor, maybe you make a plan to reduce the dose if possible. For safety, if you want to drive when using fentanyl, please wait 2 weeks after starting to use fentanyl, because you need to see what side effects you're experiencing. If you're experiencing any dizziness or sedative effect, then please don't drive when using fentanyl, because it might be dangerous. But if you aren't experiencing those effects, then it's safe for you to drive. Please do not combine it with alcohol. This may increase the side effects you're having and therefore can be dangerous. And for food, there are no restrictions, and you can combine fentanyl with any type of food. So what would be the correct dose? If you want to use the nasal spray, you can use the dose of 50 micrograms. This is on the bottle. And you do one spray in one nostril, and if this is insufficient after 10 minutes, you can repeat it in the other nostril, again one spray. So maximally you take 100 micrograms per time, and you can do this every 6 hours when you have breakthrough pain. If you want to use the tablets, the buccal ones, start with the dose 100 micrograms, which you can go upwards to 400 if necessary. You take them, and then if this is insufficient, after 30 minutes you can take one again. So maximally you take 2 of 400 micrograms, which is 800. You can do this every 4 to 6 hours when you have breakthrough pain. And if you want to use the sublingual tablets, the ones you put under your tongue, start with the dose of 100 micrograms, but you can go upwards to 400. You take the tablet, and if it's insufficient pain relief, after 15 to 30 minutes you can take another tablet. Maximally you take 2 of 400, which again is 800 micrograms. You can do this every 6 hours. And lastly, if you want to use the lozenge ones, they only start with 200 micrograms and can go upwards to 800. So repeat after 30 minutes if you have insufficient pain release. So maximally you take 1600 micrograms. You can do this every 6 hours. Fentanyl is a very good painkiller, but it also can have side effects. So very commonly we see sedative effects, dizziness, headaches, nausea, vomiting, constipation, and some itchy. Commonly we see confusion, disorientation, migraine, weight loss or just increase, some visual disturbances, muscle pain, chills, or allergic reactions. And then uncommonly we can see any of these, so fever, coma, cough, breathlessness, a high or low blood pressure, fast heartbeat, sleeping problems, diarrhea or farting. I didn't name all the side effects, there are many more and you can find them in your prescription. If you think you might be experiencing any of those side effects, always contact your doctor to see if maybe the dose of fentanyl needs to be adapted or maybe another painkiller is more suitable for you. If you want to use fentanyl when you're pregnant, know that this is harmful for you and your baby, may lead to addictions in the baby and can cause side effects, and therefore it's not advised to use it while pregnant. For lactations, which is breastfeeding, fentanyl can also pass through the baby through the breast milk to the baby and can be harmful, and therefore again it's not advised to use fentanyl when breastfeeding. So this was my short and to the point overview on the use of fentanyl. I hope it was clear. If you have any questions, feel free to ask them in the comment section and subscribe for more upcoming videos. Thank you for watching and see you next time.